Hi, folks. Ron Ray here with Turning 65 Solutions, Tax and Insurance. We've got Medicare in the news today. If you are a retired teacher from the state of Texas, a retired public teacher, and you fall under the Texas Teachers Retirement System, otherwise known as TRS, there's something very important you want to take note of. There's something very important you're going to want to take note of. The 85th legislature, which just finished up their first regular session, started on January 1st of this year, made some changes to the TRS healthcare plan for Medicare eligible retirees. I'm going to read directly from the TRS webpage. If you're not familiar with that, you need to go check it out. It's www.trs.texas.gov. Right on the front page is a big bulletin, but here's the page. Here's what you need to know. I'm going to start reading right here in the beginning. As a result of recent legislation passed by the 85th Texas Legislature beginning January 1st, 2018, TRS Care will offer a single TRS Care Medicare Advantage plan. The plan will be available to Medicare-eligible retirees and their Medicare-eligible dependents and is similar to the current TRS Care Medicare Advantage 2 plan. Medicare-eligible participants will still have access to Medicare prescription drug plan, an option similar to the current Level 2 Medicare prescription drug plan through TRS Care. In addition, beginning January 1st, 2018, Silver Script, an affiliate, there is a grammatical error in the Teachers Retirement website, an affiliate of CVS Caremark will begin administering the prescription drug plan. What's not changing is your access to a broad choice of quality doctors across the state. Unlike many Medicare Advantage plans, TRS Medicare Advantage allows you to go to any doctor you choose as long as they accept Medicare, and here's the kicker, folks, and agree to bill Humana. So, what they've done is they've eliminated the TRS Care standard plans and gone with Medicare Advantage only. Previously, you've had your choice of two different plans, either a Medicare Advantage plan or the TRS standard plans. The standard plans work much the way the plans worked before you turned 65 and went on Medicare. For TRS Care Level 2 or 3, that's what most people have. This is how they work. So this is, I go back up and show you this effective 9/1/16 to 8/31/17. So this is the current standard plan. If you had TRS Care Level 3, you had a $400 deductible, and then you paid 20% up to the maximum amount out of pocket of $4,900, and you had a prescription drug plan that was pretty good. This plan will no longer be available as of January 1st, 2018. Normally, the period runs from September to August, but in this case, they're giving you until January 1st just to make the plans, the effective dates of the plans all the same and give you a little bit extra time to adjust and get prepared. Now, here's the premiums. If you were currently on the plan and you had 30 plus years of service and you had TRS Care Level 3 with 30 plus years of service and you were an individual, you were currently paying $90 a month for your plan, plus the $134 a month for Medicare or whatever your Medicare amount is. Some people pay different than that, but most people are currently paying $134 a month. And if you have you and your spouse on the plan, then you're currently paying $235 for TRS Care 3 with 30 plus years of service. If you have less years of service, then you pay more, but we're just going to assume for our purposes here that you have 30 years of service and you're paying $235 for your family, $235 for you and your spouse, or $90 for yourself. Now, you also have available to you currently a Medicare Advantage plan. There's two of them. Now, they're comparing this new one to the Level 2 plan, which I've never run into anybody that has this plan. Anybody I've ever seen with the Medicare Advantage plan has the Level 3. And if you have 30 years of service or more, then you're paying $75 for it as an individual, or $205 a month for you and your spouse. So we have two different plans, a standard plan and a Medicare Advantage plan. We know from past videos that I've done that there's two ways to go with Medicare: original Medicare or Medicare Advantage. Now with original Medicare, this is where you keep original Medicare A and B. They're your primary payer. The government pays a portion of the bills, and your supplement, in this case the TRS Care Standard Plan, picks up your portion of the bill. So if you had this TRS Care Level 3, Medicare pays 80% of the bill, which leaves 20% for you to pay. And under the TRS Care bill, they will pick up the bill after you've met a $400 deductible. After you've met the $400 deductible, then you pay 20% of the 20%. So your out-of-pocket typically is actually pretty small with TRS Care Standard plans. Now, that's not the case with the TRS Medicare Advantage plans. Under Medicare Advantage, what happens is you actually give up your government-issued medical care plan through original Medicare for that one calendar year, and you are contracted out to a private insurance company that you choose. In this case, TRS has chosen Humana as their provider, and Humana rules the roost. They make the rules, as they've contracted with both Medicare and the Teachers Retirement System of Texas. But they're calling the shots. You are out of original Medicare for that year. And a lot of people have problems with these plans. So if we go back to this page here, where TRS is talking about the new plans, it says, we're not changing your access to your doctors unless you currently have a TRS Care Standard plan where you truly can go to any doctor who accepts original Medicare. Now, we're going to say you can go to any doctor you want to as long as they'll accept Medicare Advantage plans and agree to bill Humana. What else it doesn't say right off here to the right of this word is and accept whatever small amount Humana is going to pay them. And folks, a lot of doctors are just not willing to do that. They have bills to pay as well, and what Humana pays them typically just does not make sense to them as a business decision to accept that plan. But here's what the coverage looks like. How the 2018 TRS Medicare Advantage plan works: you have a $500 deductible, and that's first dollar benefits, folks. You're paying the first $500. Remember, original Medicare's out, so you truly are paying the first $500. And then you pay a 5% co-insurance or a copay after meeting your deductible. So it's not a bad plan. It's a 95.5 plan, but you pay the first $500 and then a maximum of $3,500 out of pocket annually. You have a $5 copay for the doctors, $35 at the urgent care center, $250 for a hospital stay, outpatient hospital stay, $10 at the specialist, $65 at the emergency room, $500 inpatient hospital, and a pretty decent prescription drug plan. As it Medicare Advantage plans go, this one's pretty good, I have to admit. The problem is, with this plan, you've got to get the doctors and the hospitals just to let you through the doors with it. If you can get them to let you through the door, then it'll probably work out okay. But in our area, we're in the San Antonio, Texas area, and about half of our major hospitals in this area just dropped Humana as a provider last year. That would be the Baptist Healthcare Group. And we just had a lot of people around here upset about that because a lot of their primary care doctors are directly affiliated with the Baptist and would no longer accept their insurance. Even if the plan said, yes, you can go to any doctor you want to, just tell them to send us the bill, the doctors just aren't willing to do it. So that's a problem. Here's the other problem. In 2018, for Texas retired teachers, your prices are going up. If you have TRS Care 3 standard plan currently with 30 years of service, you're currently paying $90 a month. Well, guess what? In 2018, it's going to go up to $146. That's an increase of $56 a month. And if you have both you and your spouse on it, you're currently paying $235. Next year on January 1st, that's going up to $590 a month. That's an increase of $335 a month. If you currently have the TRS Care Medicare Advantage plan with 30 years of service, you're currently paying $75 a month. In 2018, that's going up to $146. It's no longer based on your time in service. Everybody pays the same. A 20-year retired school district employee pays exactly the same as a 30-year retired school district employee. They've leveled the playing field. There's no advantage for working longer. And if you currently have both you and your spouse on the Medicare Advantage plan, you're currently paying $205 a month. January 1st, that's going up to $590. That's an increase of $385 a month, folks. That is a lot of money. Your copay is $5 a month, $5, but look what you're paying, $385 a month more. $385 a month more. Folks, that's a lot of money, and it's not good coverage. It's not good coverage. It's not coverage at all if your doctors won't let you through the door. This is bad news, folks. If you are a retired teacher or retired school district employee in the state of Texas, you need to contact a good independent insurance agent that specializes in Medicare and specializes in retirees. If you're turning 65 and you're a retired school district employee, you've got an opportunity right now to opt out of your TRS care benefits and go with a private plan that will cost you less and provide better coverage and better choice of doctors and hospitals. If you're a retired school district employee in the state of Texas and are already on Medicare and TRS care, either the standard plan or the Medicare Advantage plan, you will have an opportunity to opt out of your TRS care plan and opt into a Medicare supplement on a guaranteed issue basis. That means that in the state of Texas, you may voluntarily drop your employer-sponsored plan, like this TRS healthcare plan, and then buy a Medicare supplement, say like a Plan F from any company you choose, and get into that plan with no health underwriting, no health questions asked. As long as your check clears the bank, you've got it. All we need is a letter from TRS stating that you have chosen to drop that Medicare, that retirement plan. Not all states allow a voluntary disenrollment. Texas does. So even if it's you're choosing to drop your employer-sponsored plan, you can still get into a Medicare supplement with no health questions asked. Folks, if you have questions about this or you're concerned about what's going to happen with your health care if you're a retired teacher in the state of Texas, give us a call. We can answer your questions. We're well-versed in the TRS system and how these plans work and what you can do to protect yourself and do better out there on the private market. We've been in business for a long time. We've been dealing with school district employees for a long time, and we can answer your questions. Give us a call. The number is 800-515-4031, 800-515-4031, or visit us on the web at T65S.com. That's for Turning 65 Solutions. That's T65S.com. Again, my name is Ron. Thanks for spending some time with us.